Hello everyone, I'm going to talk about the difference between conus medullaris versus cauda equina syndromes. So these two syndromes are very important for all the USMLE exams, part 1, part 2, and part 3. You need to know the difference between these two diseases and how the patient is going to present in the question vignette, and then you can differentiate about this one. So the first of all, what is conus medullaris and what is cauda equina? These are the two associated with the spinal cord. So at the end, the location where the spinal cord finished in the spinal cord finished in the vertebra, it's called the conus medullaris. And then the continuation of the spinal cord with a different uh, small nerve roots or vessels, sorry, nerves, uh, leads towards to innervate your lower part of the body after the L2 and sacrum. That's where the cauda equina is. These are the nerves. So this is the part. Conus medullaris is actually the end of the spinal cord. Cauda equina is where the small nerve roots that just continue from the spinal cord. The whole spinal cord doesn't continue all the way to the down. So that is very, very important. And it innervates the area below L2 and sacrum. That is the level to differentiate between conus medullaris. And as you guys can see in the second, what level in the spinal they are, the sacral cord segment and roots. So conus medullaris covered the sacral cord segment. However, the cauda equina covers the limbosacral sacral nerve roots. Uh, the way they present is totally different. The cauda equina is unilateral, and conus medullaris is bilateral. The reason why conus medullaris is bilateral because it is actual spinal cord that is innervating both sides of the extremities. So you are going to affect it as when you get affected with the spinal cord injury. However, cauda equina, because these are the roots, the nerve roots are going to be affected. So depending on where the lesion is, if you are being affected by the nerve that innervating on the right side, you're going to get the right side symptoms. Or if you are get injured on the nerve roots that is innervating your left side, you're going to get the left side injury. So very important to differentiate that part because conus medullaris is always bilateral, and cauda equina is unilateral. And the both will have a radiculopathy, the pain that radiating pain towards the legs. The both is going to have cauda equina have more severe than conus medullaris, and lower back pain. The both has the lower back pain. However, conus medullaris has the less lower back pain uh, compared to the other one. So now motor strength. How is the motor strength? Is again, as I said, the cauda equina and conus medullaris. The difference between unilateral or bilateral. So the conus medullaris, either it is bilateral and it is symmetric. The both sides will have the similar symmetry in the weakness or in the muscle problem, motor problem. However, in cauda equina, you will have asymmetric paraplegia or atrophy. And also conus medullaris is mostly upper motor neuron lesions than this one. And in conus medullaris, there is only ankle reflexes affected. However, in cauda equina, you're going to have, as you can see, that both knee and ankle jerks are affected. Now, the sensory is also very important. Localized numbness to the perianal area in conus medullaris, and localized numbness at the saddle area. So saddle anesthesia is very important in cauda equina. You will have a cauda equina, you will have saddle anesthesia. And sphincter, early urinary and fecal incontinence, you're going to see in conus medullaris, but in cauda equina. So all the urinary problems in conus medullaris are presented early. However, in cauda equina, it presented late. Okay, impotence frequently is very frequent in conus medullaris, and it is less frequent in cauda equina. So to just recap, conus medullaris is the part of the spinal cord. So the patient is going to present with a symptom that is mostly bilateral, and you're going to have the hyperreflexia. You also going to have the sensory loss on the perianal area. However, in cauda equina is very severe disease. It's going to be unilateral. It is the nerve roots that are going to be damaged, and it is going to have a saddle anesthesia. And you're going to also have you're going to lose the knee and the ankle reflex. The both reflexes is going to be affected. However, in conus majularis, there is only one. So this is going to be that is going to be the end of the video. I want to keep it short, and I will come back with another important small topic to present on. So thank you very much for listening to me. Bye bye.